Right, this is Dr. Hervey. Wanted to talk to you about saying no to the primary C-section for breech presentation. In my practice, I've had the great opportunity to take care of a lot of patients who come in who want an external cephalic version for breech presentation. And many times I do explain to the patient, we don't know why your baby's breached. There could be multiple different factors that cause the baby to be breached. In that discussion, we talk about ECV. Again, I suggest that ECV is not 100%. Not all babies will turn because there's a lot of different variables. But I always start off by telling the patient this. What I care most about is, one, having the opportunity to turn the baby. But if the baby doesn't turn, you get to go home. If the baby does turn, you get to go home. My goal is for you to go home after this procedure, whether it's successful or not. I don't want to take you back to the OR and do an emergency C-section. I don't want to take you back to the OR and do a scheduled C-section. I want you to go home. I want you to come back into the hospital laboring. I want you, the patient, to come in actively laboring. If you and your baby happen to be cephalic, head down, and you came in laboring at 2 o'clock in the morning, whatever provider's on in their group or team or whomever is going to wake up, come in, greet you, and help you in that labor process. There's no difference if your baby's breech. You should be able to walk into the hospital, contracting, laboring, and deliver via C-section, which is the community standard, but having had a labored cervix. If you walk into that hospital at 39 weeks, provider suggested you should just have a C-section at 39 or 40 weeks scheduled versus that of coming in laboring, well, you're doing yourself a big disservice. That disservice, in my opinion, is not allowing the cervix to experience labor, not allowing yourself to dilate. Because when you come in for the next baby, you'll have been closed, thick, and high, never experienced labor, and you'll be looking for the opportunity for a VBAC. And in my personal medical professional opinion, that's where we fail. I recognize that every one of my moms who desire ECV, external cephalic version, who have a breech baby, they want another pregnancy, they want another baby. And having never experienced labor makes it very difficult to have a successful VBAC at the next pregnancy. That cervix has never experienced labor, it's never dilated. You should be allowed to labor. You should come in. We should greet you at that labor and perform that C-section at that point in time. So again, my message to you today is say no to that primary scheduled breech C-section. Come in laboring. Have your C-section on a labor cervix. It will do a world of difference when it's time for you to have your VBAC in the future.